My purpose in life really is to take care of people without the regard for the ability to pay for the care that they receive. To have the ability to actually change people's lives. It's always been the case. My name is Gbenga Ogedegbe. I am an internist, a professor of medicine and population health. I am the founding director of the Institute for Excellence in Health Equity at New York University Langone Health. I am the founding director of the Center for Research in Health in Africa. Just imagine, as we speak now, every 7 seconds, somebody just had a stroke somewhere in Africa. The purpose of CAReH Africa is to actually address the 3 major factors that drive poor health in Africa today. One is the acute shortage of healthcare workers. 2 is the uncoordinated nature of the healthcare systems that we have. And 3 really is that we have a huge burden of disease, but don't have enough workforce to address it. So I founded this initiative that's called the Center to Advance Research in Health in Africa. And the mission of that organization is really to actually leverage our human resources to build capacity to address the burden of disease in Africa. With that frame of mind, my research focus was to look at ways to address the burden of high blood pressure or hypertension in low-income minoritized populations. And so what does that mean? I'd love to train people on the continent to do research and to stay back on the continent. We've got to be more proactive in training people to begin to appreciate the power of the human resources that we have on the African continent. So I think that's a game changer. When you look at healthcare in a country like Nigeria and other low-income countries, what you find is that the majority of the factors that drive poor health in these countries are driven by what we call the social determinants of health. So the social determinants of health are the conditions in which people live, in which they play, in which they walk, in which they pray or worship. Those conditions explain at least 80% of the poor health that people have today. So let me share some numbers with you. Africa has 14% of the burden of chronic diseases. This is data from 2008, but they only have 3% of the workforce. So the question then becomes, how do we address that? CAReH Africa is focused on not just driving innovation around how we leverage the human capacity of our non-physician health workers to deliver tasks that primary care physicians will ordinarily deliver. We're not only training nurses to deliver healthcare, but an important aspect is also focusing on how we can actually increase the ability and the capacity of African scientists to conduct research that is relevant to the care they have to provide to their own communities. That means that the communities that we serve, for them to actually know that we care for them, CAReH Africa, we've got to have the following values: compassion, equity, access, integrity, and trust. Those 5 values encompasses what CAReH Africa stands for. What that then does is it allows the patient to appreciate that you actually care for them, because you have a deep understanding of the conditions that make it difficult for them to engage in healthful behaviors. So it's very important for us in CAReH Africa to have the ability to incorporate, to integrate, to infuse all of these values into the training that we provide. The reason you're all doctors is not so much because you have to be educated. We all do, right? It's because people out there where we just came from today, somebody has to take care of them, right? It's population health. It's important. Somebody has to do it. It doesn't matter how you think. The reason you're in medical school is not because you want to make money. The money will come. There's no question. But somebody has to do that health work. And that is the most important thing. You know why I say that? Maybe not some of you, but when I'm sitting there in that market today, I see my mother in everybody. Am I making sense? I see my aunts, I see some of my cousins. That little baby that was being breastfed, I was talking to Prof that could be the next doctor that we ever have in this area. Some of us were raised like that, actually. So it's important. So you're going to ask, why did you leave? Well, I'm back. Fully, strongly, and doing very important work in this place and in Ghana. So I want you all to think about, what is your purpose? Where do you belong?